Diabetes is the epidemic of the 21st century. Diabetic Australians have shown 1.7 million Australians have type 2 diabetes. So what can we do to avoid it or prolong it? Today we're going to discuss what type 2 diabetes is. We will study the pathophysiology and how to manage type 2 diabetes in relation to a case scenario of a person who is living with type 2 diabetes. With me today we have Ms. Emily Gilbert, who was diagnosed with type 2 diabetes and schizophrenia.
Well, it has been 3 years since I collapsed at work and was brought into the emergency department by paramedics for hypoglycemia and mild dehydration. I missed a few meals because I was hallucinating as a result of my recently diagnosed schizophrenia. I was still adjusting to the medication I was put on, so I couldn't take care of myself properly, and I thought I didn't have any close friends or family to help look after me.
Hello, who do we have today?
Yeah, so we have Miss Emily Gilbert, who is here, who is 38 years old. She lives alone and has never been married before. She was found collapsed at work. Co-worker explained that Emily has been recently diagnosed with schizophrenia.
Oh, schizophrenia?
Yeah.
Okay.
And has been missing lunch over the past few days.
Do you know how long?
I don't know.
Okay.
Yeah. And has had lack of association with friends. She has type 2 diabetes. Her blood glucose level is 2.0.
Okay.
We got doctor review and he ordered glucagon 1 milligram IM.
Okay.
Her vital signs are as follows. So blood pressure 151/70 manual.
Cool.
Heart rate is 110
Okay.
regular and strong. Respiration and oxygen saturation is within the normal range. Her temperature dropped to 35.5. So we gave her heart heating blanket.
According to National Safety and Quality Health Service Standards, Standard 6, Clinical Handover, to ensure that a timely, relevant, and structured clinical handover occurs that is appropriate to clinical setting and context of handover that supports safe patient care. Now, before we look further into the case scenario, let's look into the pathophysiology of it. Diabetes mellitus is a chronic multi-system disease related to abnormal insulin production, impaired insulin utilization, or both. What it means is that when we eat, our food is converted into substances that we need for our body to grow and function. One of the substances that we're going to talk about today is glucose, or in a simple word, sugar. Glucose enters our bloodstream and to be used as fuel in the body. Just like a car, glucose is the petrol for our body to work. Pancreas, which locates near our stomach, play a key role in making a hormone known as insulin, which has a job of transporting glucose to be stored for future use in places like muscle, fat, and liver cell, as well as to balance out the blood glucose level. However, for those who are diagnosed with diabetes, for example, Ms. Emily Gilbert will have hyperglycemia. Either high or low blood glucose level does damage to our body. There are 3 types of diabetes. Type 1 diabetes is when people are born with it. The symptom may not present immediately, but the process may be present later on in life. Those diagnosed with type 1 diabetes may not produce enough insulin or not produce insulin at all. So it leads to high blood glucose level in the bloodstream. Whereas type 2 diabetes is more common and it could occur at any age, but usually more common for those aged 35 or older. This is due to unhealthy lifestyle, failure to exercise, and poor diet. In type 2 diabetes, the body produces insulin. However, it's either not produce enough insulin or the insulin is not working properly. Therefore, it leads to excessive glucose and increase the blood glucose level in the body. Lastly, Gestational diabetes is occurred when blood glucose levels are high during pregnancy in women. Women with gestational diabetes are at risk of cesarean delivery, and the baby is at risk of perinatal death or birth injury. Symptoms of the various kinds of diabetes are similar, or in some cases there are no symptoms at all. However, some that we can recognize are frequent and painful urination, thirst, open wound or cut that are slow to heal, blurred vision, tiredness, and weight loss. So what harm does diabetes do to our body? Well, the main issues, the heart. Long-term complications can lead to stroke, hypertension, coronary disease, and much more. Also, having high blood glucose level does damage to your blood vessel, which means many parts in your body will receive less blood, especially the kidneys, eyes, brain, liver, and the nervous system. Now, after explaining how bad diabetes can be to your body, you will want to know, is there any way to prevent or cure for diabetes? Unfortunately, there is no cure yet, but we can help prevent, prolong, and promote better care for those who is already diagnosed. But we will further discuss about this in the nursing intervention and pharmacological related to our case study.
Primary survey. To perform a primary survey, we assess A, B, C, D, and E. Assessment and intervention. Airway. To check the airway, we open the mouth and observe to see if there is anything abnormal. We should be looking for cuts, bruising, foreign material, blood, vomit, or anything else that could be a choking hazard. Breathing. We need to make sure that the patient's breathing is normal. To do this, we need to check their respiratory rate, depth, rhythm, and movement of the chest. We also need to auscultate the lung sounds for abnormalities. Circulation. Next, we need to check the patient's cortical pulse, assessing rhythm, rate, and quality. We also need to assess the skin for color, temperature, and moisture. Next, we should check the capillary refill in the fingers or toes and assess for external bleeding and measure the patient's blood pressure. Disability. We need to do a brief neurological assessment to assess the consciousness of the patient by determining their response to painful stimuli and verbal response. We also need to assess the pupils for size, shape, equality, and reactivity. We also need to identify deformities and determine the range of movement and strength in extremities. Exposure and environmental control. Assess full body for additional or related injuries. After we conduct the primary survey, we next have to conduct the secondary survey. The goal of a secondary survey is to obtain vital signs, treatment, and a head-to-toe assessment, making sure that it is documented accurately and correctly. The performance of obtaining vital signs, focus adjuncts, and giving comfort measures will be conducted in the next part of the video. Another part of the secondary survey is to facilitate family presence, which includes determining the carer's desires to be part of the treatment process. History and head-to-toe assessment is a large part of the secondary survey, but we are just going to talk about it briefly. We need to check the patient's medical history, which includes allergies, medical history, past history, last meal, and events leading up to their illness or injury. To do a head-to-toe assessment, we need to check each of the areas of the body, including head, neck, face, chest, abdomen, flanks, pelvis, perineum, and extremities, and inspect the posterior surfaces too. We can do this by utilizing all our senses through auscultation, palpation, percussion, and observation. The secondary survey needs to be conducted every 15 minutes while the patient is unconscious and every 30 minutes after the patient regains consciousness.
I'm just gonna take your blood glucose level now. Are you feeling cold? I brought you some blanket. Keep you warm. They took the heated blanket off, so you've been cold. I'm just gonna take your blood glucose level now, since they say you're hypoglycemia, and I'm worried about that before I give you your medication. seems your blood glucose level is really low, and I'm just gonna go and get your medication ready. Sorry, can I please see your UR number? 3008192, and we have Miss Emily Gilbert, born on the 1st of January 1979. I got you hydrochloride here. Glucagon hydrochloride to help reduce your blood glucose level, and I'm just gonna give it on your thigh, okay? Just gonna lift it.
NSQHS Standard Number 4 Medication Safety. Ensure safe and accurate prescribing, dispensing, supplying, and administering through the 5 rights: storing, manufacturing, compounding, and monitoring of effects of medicine, and accurate documentation.
Now in this section, I'm going to talk about the pharmacological. I'm going to talk about the medication we administered to the patient, why did we administer it, and I'm going to talk about the medication contradiction, side effects, safety, and monitoring. Glucagon is a hormone produced by the pancreas that stimulates the liver to break down glycogen into glucose. Therefore, we administer glucagon hydrochloride to break down the glycogen into glucose, as Miss Emily Gilbert is having hypoglycemia, which means low blood glucose level. The side effects of it would be nausea, vomiting, abdominal pain, hypersensitivity. The only contradiction we're having is only if the patient is having tumor. However, for safety and monitoring is to not give glucagon hydrochloride as IV infusion, and for patient who is going to have a gastrointestinal test might feel a bit discomfort. Other than that is to educate the patient, family and friends about hypoglycemia and to be aware of it. The response to glucagon should occur within 10 minutes. If no response, IV glucose is to be administered. Giving complex carbohydrate if respond effective to glucagon to sustain blood sugar level. However, in the case of Miss Emily Gilbert, we didn't give any complex carbohydrate. It's because she is not unconscious, but she is not able to chew or swallow anything at the moment. So we give her glucagon hydrochloride as an alternative. Hello Emily, I'm Ashley. I was the nurse taking care of you in emergency. How are you feeling?
Yeah.
Any pain? The bruises on your head are still hurting? Okay, so I know that you're better now, your blood glucose level is all good, but I'm still concerned how you're going to take care of yourself at home. So I'm here to educate you about it. I just want you to understand that right now you're sick and you need help and support, and we are here to help and support you. You're having schizophrenia. So you will be having hallucination, delusion, loss of drive. So it will be really hard for you to take care of yourself all by yourself while you also have type 2 diabetes. But it's okay, we're here to help. So I want you to always able to go back and understand what your schizophrenia really does to you. So I give you a voucher so you can just read it. And I also have information in regards to your diabetes and what we're going to talk about today and all the support you'll get in here. As well as your schedule and when do you have to take your medications in here as well. I'm just going to give that to you. Now, first of all, it's really important for you to take your medication regularly. But I understand you might forget or you might miss a meal and all that. So How about we change our strategy by using your phone as a reminder when to take your medication, when to check your blood glucose level. We can set a reminder on your phone. Is that okay? It's also good if you can write a diary. So it will help prevent a relapse of your schizophrenia, and you can always go back and reflect on it. It helps improve your both mental and physical health. Okay? And you have to understand that type 2 diabetes, currently there's no cure, but we can always promote it to a better life. So you have to make lifestyle changes. You have to go on a good diet, you have to exercise more, okay? And we talked about it before as well, about it. I also have organized community nurse to come and see you. So they go to your house, help you check your blood glucose level, do all the vital signs to check your heart rate, blood pressure, to make sure you are okay, and to check if you're taking your medication regularly. I also schedule you to see a therapy. It's called cognitive behavioral therapy. It helps with your mental health and also coping strategy. So you help to cope with everything's better, as well as your medication. That's what we're concerned with, and everyday lifestyles. So that's all I got for you there in the booklet. As well as I want you to understand that you have to take your blood glucose level very often, especially before you eat, after you eat, and before you take your medication, after you take your medication. Checking your blood glucose level is important because it gives you early warning sign of what will happen or what you have to do. For instance, if you're having a low blood glucose level, immediately you have to take a snack. But if you go into a case where you slightly turning to be unconscious, I also got you a hypoglycemia emergency kit, but I will educate your carer about it as well, just in case you are unconscious and they can help. Alright? So it's important to check your blood glucose level, change your lifestyles, exercise, and it's okay to get help. We're here to help you. Alright.
In this section, we are going to talk about the medical history of Miss Emily Gilbert in relation to pharmacology. Again, we're going to discuss the contradictions, side effects, safety, and monitoring of the medication. Glycoside, sulfonylurea agents stimulate insulin to be released from functioning pancreas cells. In the case of Miss Emily Gilbert, it was used for her type 2 diabetes because she was unresponsive to diet alone. Side effects include hypoglycemia, anorexia, nausea, diarrhea, heartburn, headache, blurred vision, rash, and athemia. This medication can contradict with patients who are diagnosed with type 1 diabetes and those hypertensive with sulfonylurea. It can be contradicted with the use of micronazole. With safety and precautions, we need to make sure that Ms. Gilbert takes her blood glucose level before and after medication, that she applies sunscreen as she may be more sensitive to light, that she takes the medication with food to minimize hypoglycemia events, and that she needs to avoid alcohol.
Insulin aspart is a rapid-acting analog of human insulin that rapidly lowers blood glucose level. So in case of Miss Emily Gilbert, is to be given after she had her meal to lower the blood glucose level. The only side effect for this medication is hypoglycemia and also the injection site reaction. The contradiction is not to be given if hypoglycemia. For safety and monitoring is to educate the patient to be alert and aware of hypoglycemia symptoms, check the blood glucose level before taking this medication, educate about when to take it, monitor the site of injection, education on needle and injection safety. Lastly, olanzapine is a treatment of schizophrenia and related psychosis. Olanzapine was given to Miss Emily Gilbert because she is diagnosed with schizophrenia. The side effects of it could be bloating or swelling of face, arm, hands, lower legs or feet, blur or impaired vision, change in walking and balance, difficult with speaking and swallowing, repeat weight gain, restless and stiffness. The production of it would be contradicted with hypertensive to the ingredient of the product. So for safety and monitoring for Ms. Emily Gilbert is to monitor for worsening of glucose control and to monitor of weight gain.